I'd like to introduce you to our panel tonight. First of all, we have Dr. Wanda Dyson. She is the author of How to Be Healthy. It's Not What You Think. And she also very recently completed an ebook, the COVID-19 Survival Guide. So she is perfect for tonight's topic. And you see her credentials on the screen. She got her bachelor's at American University here in Washington, D.C. She did her medical education at the University of Louisville. She did a residency in Washington, D.C. at Howard University. She is the founder of Change for Life Wellness and Aesthetics. And she's also New Thought, a member of Unity of Washington, D.C. So you will be hearing more and seeing more from her in just a few moments. We also have tonight Marita Golden, who is a prolific writer. She was actually one of my writing coaches. She has her undergraduate degree from American University in Washington, D.C. She went on to Columbia University and got her Master's of Science in Journalism. She was nominated in 2018 for the NAACP Image Award for Outstanding Literary Work, and it went to Louis Gates. So she was in very, very good company. In 2002, she was a recipient of the Authors Guild Award, and she has become a health advocate. Her two most recent books, I'm going to show those to you now. Us Against Alzheimer's, and then The Wide Circumference of Love, deals with Alzheimer's and its disproportionate impact on African Americans. So I refer to her now as a health advocate. She has other works as well, and one of my favorites that she wrote a long time ago, but is still relevant today, is Saving Our Sons. And you all just had a very brief introduction. You heard Eugene Holden, and he's known to most of us at Centers for Spiritual Living, where he served, as I mentioned, for 10 years with our World Ministry of Prayer. He's a past liaison to the Diversity and Inclusion Commission. He was on Home Office staff at that time, and we have a liaison so that we stay abreast of what's going on at Home Office, and they know what we're up to as well. You probably recognize him from the Science of Mind magazine, where he has a regular column. He writes the daily guides, and he submits many, many articles to our magazine. And he is a student of the Science of Mind philosophy and has been for over. My question is, 20 years. From your experience and knowledge base, what are the contributing factors to these data?
So the contributing factors are not that much different in 2020 as they were in 1906. In 1906, W.E.B. Du Bois wrote a paper based on a study. It was on the health and physique of the Negro American, and it was a social study made under the direction of Atlanta University. 51% of African Americans' deaths then were due to consumption, which is another name for tuberculosis and pneumonia, infantile marasmus, which was severe malnutrition, cholera, which is diarrhea and dehydration from contaminated water, and inanition, which I had never heard of before, which is exhaustion from lack of nutrition, as well as heart disease. According to the 2017 stats, 50% of the deaths in African Americans are from heart disease, cancer, and accidents. In 1900, the Atlanta Board of Health reported the Black death rate exceeded the white death rate by 69%. In 1900, W.E.B. Du Bois found that African American death rates were 2 to 3 times that of whites for several diseases. In 2015, Blacks younger than 65 years old had a 40% higher death rate than whites for all causes. In 1900, of the 1,467 black babies born in Philadelphia, 25% died before 1 year old. In 2017, the infant mortality of African Americans was 2.3 times the infant mortality of non-Hispanic whites. So not much has changed. In the 1900s, I can attribute a lot of those causes of death to nutrition. Marasmus, the severe malnutrition in the child, and inanition, exhaustion from poor nutrition. In the 21st century, in 2017, I believe, there was a study on nutrition deficiency and whether people had 1, 2, or 3 to 5 vitamin deficiencies or anemia. They found that 55% of non-Hispanic Blacks had nutritional deficiencies, 40% of low-income individuals, and 39% of the obese. And we think of obese people as eating so much that they wouldn't lack nutrition, but they actually are nutritionally deficient. There is also a sleep gap between African Americans and their white counterparts or any other racial or ethnic group. And this stems back to slavery. There was sleep inequity dating back from the transatlantic slave trade when we were brought here in chains packed like sardines. Nope, and in slavery, there was no privacy. We slept in very tight quarters on the bare floor. There was no, we were so sleep deprived that at times they described slaves falling into hot vats of fiery boiling syrup. Nowadays, let's go to this year, we still have an issue with sleep, that most African Americans sleep less than the recommended, they say 6 to 9 hours, but in my opinion, it should be at least 8 hours. And it's related to how we live. We may live in noisy, more dangerous neighborhoods. We have short, shallow sleep. We may be working rotating shifts or night work. We may have increased hunger, fear of violence, police harassment, and I didn't realize that we also have less slow wave sleep. And slow wave sleep is important because that is the aspect of sleep that allows your immune system to get turned on, which helps protect you against viruses, bacteria, and cancer. And most of the causes, the current causes of death in African Americans, 8 out of 10, I can link them back to lack of sleep. Heart disease, cancer, accident, stroke, diabetes, kidney disease, and septicemia, which is an overwhelming bacterial infection, are all linked to lack of sleep. And when we don't get enough sleep, we build up a type of fat in our bodies called visceral fat. And visceral fat increases inflammation, which leads to diabetes and hypertension and heart disease. So it's a self-perpetuating issue. Not much has changed in over 100 years as far as what we're seeing in the Black community and our susceptibility to disease. I also found in my research a reason why African American males would be more represented in these numbers. And a lot of people are not speaking about this. Haven't really heard anybody speak of it aside from myself so far. But 1 in 10 African American men have what's called G6PD deficiency. That's G as in girl, the number 6, P as in Paul, D as in dog. And what that does is that makes their red blood cells more susceptible to a trigger. A trigger can be a medication or an infection, as in a viral infection. The viral infection, coronavirus, is a bit different from the one studied before, but back in 2008, there was an article in the Journal of Infectious Disease that showed that coronavirus 229E could enhance the destruction of the red blood cells in individuals that have this G6PD deficiency. There are also drugs that do this. Now, the drug that Trump is touting, hydroxychloroquine, is in the same group of anti-malarial drugs as a drug called Primaquine. And Primaquine was actually studied in African Americans between the 1940s and 1960s, and in African American males, and they found that it destroys the red blood cells. So if you look at the drug hydroxychloroquine and you look at the drug Primaquine, you can Google it and look at those chemical structures. They are almost identical. Now, fast forward again to 2020, they have rushed a study to occur in Detroit, and it's going to involve 3,000 individuals. Detroit is a city that's about, I've seen different numbers, but it's 84% African American. I don't know what percentage the gender mix will be, how many African American males, African American females, or others, but I think this is a dangerous thing to do. The G6PD deficiency occurs in areas where there's more malaria. So it's not only Africans that have this, it's also other groups. Mediterranean groups have it, and they have a more severe form, which might account for why Italy was hit so hard. And all those that originated from that area, which would be the Spaniards, the Greeks, the people from Turkey, all those of Mediterranean origin could possibly have this deficiency, as well as Sephardi Jews and people that live in Central and Southeast Asia, and 70% of Kurdish Jews have this deficiency. So that can shed some light as to why some groups will suffer more than others. And then, there are other things like air pollution, and that can increase the risk of getting a respiratory illness. And I read an article by Harvard, which said if they had reduced the pollution, it was like a microgram per cubic meter in Manhattan, there would have been 248 fewer COVID deaths by this point in the outbreak. And I don't remember the date of that article. So all of these things play in together. And in a New York Times article, Why Coronavirus is Killing African Americans More Than Others by Jamel Bowie, it was of 4/14/2020. What he said, I can't put into better words. He said, and I quote, "Race, in other words, still answers the question of who. Who will live in crowded, segregated neighborhoods? Who will be exposed to lead poison pipes and toxic waste? Who will live with polluted air and suffer disproportionately from maladies like asthma and heart disease? And when disease comes, who will be the first to succumb in large numbers?" There are other things, mistrust of the medical system, they call that the Tuskegee effect, disparities in healthcare, lack of testing, which I know people personally who had the symptoms who probably have COVID-19 that didn't get tested. People are staying at home without testing and ignoring the recommendations for social distancing, a lot of us don't believe it's real. Someone asked me today, is this real? And I had to send them a video of what's happening inside the hospitals in New York. One reporter was able to actually go inside and put on his personal protective equipment, look like hazmat, and actually look at what was going on. And quite frankly, it brought me to tears to see what's happening, to see what the health professionals are dealing with, what they're subjecting themselves to, possible illness and death, and bringing that home to their families.
You know, what can I do as an African American female? Fortunately, what makes me more vulnerable is my age, and that's the only thing. But what can I do so that I'm not more susceptible than the average person to these pandemics such as COVID-19? Are there some health precautions? Are there some things that I can do?
Okay, so that's why I created the Coronavirus Survival Guide. And I kind of broke it down to 3 tips. One is be calm, don't panic, because fear itself can weaken our immune system. And they've done studies of the brain, and they can see that if you have fear, anxiety, PTSD, you're stressed out, that part of the brain is active, and that all by itself can cause a heart attack, a stroke, or heart failure. So the first thing we have to do is to be calm, to reduce the stress. And there are many ways we can do that. We can do meditation. Transcendental meditation has proven to reduce PTSD, which probably before this is all over, the doctors are going to have PTSD, and many of the people who've experienced this with their families or losing other loved ones, it's a traumatic experience. We can do things like yoga nidra, qigong, any number of things, pot belly breathing, and I have some supplements in my guide that can help you to be calm. So that's number 1. Number 2 is sleep. We need to be sleeping between 9 p.m. and 2 a.m. or between 10 p.m. and 3 a.m. and we need to sleep for 8 hours. The reason for that is that's when our immune system gets turned on. And our immune system has unique cells called natural killer cells. And I call them the Pac-Man for the body. So like Pac-Man goes around the board and it chews up the little yellow circles. Those will be virus infected cells. And yellow circles will be bacteria. And the big white circles will be cancer cells. So that gets turned on when we sleep. But a lot of people during this time are really freaked out, or they're staying up, they're looking at Netflix, the computer, their cell phones and tablets, which prevents them from sleep. And I look on Facebook, many of my Facebook friends are saying that they're developing weird patterns of sleeping, like going to sleep at 3 and sleep until 10, or sleeping only 2 hours, just bizarre types of sleeping habits. And the other thing is, in order to sleep at night, we have to be exposed to sunlight. So a lot of people are interpreting this sheltering in thing as I need to be shut in my house all day. And it really shouldn't mean that. We should be able to go outside. If you have a backyard, go into your backyard, your deck, your porch, your balcony or whatever, and get a couple of hours of sunlight every day, because that primes your body to produce melatonin, and melatonin is what makes us sleepy and helps us to sleep throughout the night. So if you want to strengthen your immune system, sleep is a way to do it, and it's free. Unfortunately, as we get older, and that's in our age group, I presume we're around the same age group, it's harder to do so. So by 65, about 43 to 46% of people have trouble sleeping. And by 75, it's 50%. Then we have our younger people who are just not sleeping. We call that, they're doing it for social reasons. We call that social jet lag. They just choose not to because they want to stay up all night and party, or, you know, play video games or whatever. So that's the second thing that we can do. The third thing we can do is focus on staying well. And that's instead of, oh, what's going to happen if I get the virus? Oh, what's going to happen if I get sick and I get the pneumonia and I go to the hospital? Because people are playing out the worst case scenarios in their minds. If you focus on staying well, I guarantee you will take up most of your day. You won't have time to think about those other things. So the things that I've laid out in the manual, some of the things are vitamins, which vitamin C is one of them. But as Marita's was mentioned, her son has G6PD. If you do too much vitamin C in a person that has G6PD deficiency, that can also cause this breakdown of the red blood cells, cause them to be destroyed. So you have to be careful in that group. But we need more vitamin C. So as a female, I would presume you don't have it. It's very rare. You want to up your vitamin C dose to the point almost to diarrhea, but not there. And you don't want to have any cramping in your stomach. So it's like a pretty high dose, but minimally 2 grams of vitamin C a day. The next thing is vitamin D, and that prevents inflammation of the body and the lungs. So, but most of us, most African Americans are vitamin D deficient. And I've seen a 30-something-year-old in my practice that had almost 0. And that was like the only person I've seen with 0. But we tend to not have enough vitamin D, and the melanin in our skin blocks it. Okay, so that should be kind of guided by a physician, the replacement of vitamin D, because you want to know what your levels are. And you want to get it up to high normal. Vitamin D is a fat-soluble vitamin. That means it can be toxic if you take too much. So you don't want to overdo it, but you wouldn't know without some kind of guidance with that. Zinc is another thing that can prevent the virus from grabbing hold to our respiratory tract, and that's 40 milligrams of zinc a day. I actually have an immune protocol that increases those natural killer cells that I talked about, as well as immunoglobulins, which help us to remember that we had the virus. So the next time our body sees it, we can attack it. And so we don't know yet if we're developing an immunity. We don't know how many people have developed immunity because we're not even testing. We don't have the antibody tests out here. So we don't even know what's really going on. We're operating in the dark. So that's another thing that we can do. There are other things that are in there. There are, of course, herbs. If you want to get back, I mean, in every indigenous people, there is a system. Native Americans had a system of healing. There's Chinese medicine. In China, they are actually employing Chinese medicine. They're doing that in conjunction with Western medicine or allopathic medicine. They're doing it together. They're bringing in the Chinese practitioners, you know, and traditional Chinese medicine to work with the patients. And they, according to what they're saying, there is a better outcome. We in America, as African Americans, had a system. We understood herbs and the use of them. However, as we have gone from generation to generation, a lot of that has been lost in our community. But there's Ayurvedic medicine, there are like traditional African medicine. There are many other things that we can use to help ourselves. And that's just some of the things that I mentioned.
Great, thank you. So at the end, I want you to let us know how we can get the survival guide to COVID-19. Thank you.
Right.